In the McLennan County Trauma Service area, they have over 1,300 active cases as of right now, and their hospitalization rate is still #1 in the state at 34%. Right now, 49% of those eligible are fully vaccinated, so getting there in McLennan County. Meanwhile, the McLennan County Trauma Service area does have the highest number of COVID hospitalizations as well in the state, but we do want you to understand exactly what that means.
McLennan County Health District's Kelly Crane is joining us to answer some of those questions. Hey, Kelly.
Hello, good afternoon.
So what does this hospitalization rate mean? Why is it so high, and what can be done to get it down?
Well, the trauma service area is known as the Heart of Texas Regional Advisory Committee area, and it includes 5 counties. Of course, you have McLennan, you have Hill, Limestone, Bosque, and Falls. So you have our major hospitals in McLennan County, and surrounded by them, smaller county hospitals. It really means that our hospitals in McLennan County are packed. They are almost to capacity. They're still making options for people and make sure that everyone is served, everyone is seen, but it's really putting a strain on the hospital, upon everyone who needs health care, even those who don't have COVID.
And Kelly, you just kind of touched on it right there, but can we pinpoint any kind of reasons why we're seeing such a higher hospitalization rate in McLennan's trauma service area versus like down south at Bell County?
It's really hard to say. Of course, vaccinations have a lot to do with it, not only within our county, but outside of the county. Our hospitals are part of 2 major systems, including Baylor Scott and White and Ascension Providence. So there is the option of sending other people to our area or transferring them. So there's a lot of different reasons why people are coming to the McLennan County hospitals. The most important thing to do to stop it is very simple. Get vaccinated, not only in our county, but across the state. Everyone needs to get vaccinated. That's really what's going to slow this pandemic.
And Kelly, how do you feel about Governor Abbott's executive order against mask mandates and against vaccine mandates?
Well, the most important thing is that everyone can still get a vaccine and everyone can still wear a mask. At the Health District, we encourage everyone to wear a mask when they're in the grocery store, when they're out in public, wherever they are, and we encourage everyone, whatever their age, to continue to wear masks. So whatever the mandate is, it doesn't prevent people from wearing masks or getting the vaccine. Go ahead and do it. Take the responsibility for your health and protecting your community and your hospital.
The schools are kind of up against the governor right now. They're trying to make their own decisions on what's best for them. Have you considered issuing any mask or vaccine mandates for government employees despite the governor's order?
We will follow the governor's mandate. We are making sure to make it easier for people to get the vaccine. We are offering it to everyone. We know that there are businesses throughout McLennan County that are offering incentives to really encourage people to make it worth it. We've also had lots of people come to our clinics and just say, we've seen people that we know die. And we have people in our hospitals that are dying that we know, and they're just tired of seeing everybody else around them get sick, and they realize this is important to get vaccinated.
Kelly, I know you work hand in hand with medical staff. Are we reaching a breaking point of exhaustion between our nurses and our doctors who are really just dealing with the same thing every single day? I know just in some of the friends that I've spoken to, they went through this and signed up for it last year, and now we're kind of in this second wave. Fatigue has got to be a thing that's setting in, and I know it's probably hard to keep everybody really mentally focused after such a rough 18 months that the country's been through, and locally as well.
Absolutely. I think fatigue is a huge issue after so long. And, we talked about fatigue last year, but it's really setting in, and you're right. It's a physical fatigue of having to work so many hours and take care of so many patients. It's also a mental fatigue to see so many people die, to see so many people on ventilators, and realize that this is all preventable. I think the key here is that this hospitalization rates, the deaths, this is all preventable. We can stop COVID. You can protect yourself with the vaccine.
All right, I'm going to follow up, put you on the spot. You just said because of the vaccine, you say it's preventable. What's your #1 advice in saying goodbye right now to our viewers?
Get vaccinated.
Simple
Plain and simple.
to the point. Yeah. Thank you so much, Kelly. We appreciate your expertise. You've been great for us as a source of communication and keeping information out there for us for the past year and a half, going on 2 years. Thank you so much.
Thank you.
All right, stay with us, everybody. Still to come on this special edition of 6 News at 5. Children ages 5 to 11 are now one step closer to getting vaccinated. What parents need to know. Plus, COVID has put a strain on many hospitals. So what happens if you have a non-COVID medical emergency? Dr. Dominic Lucia answers some of those questions after this break. Stay with us.